If hepatitis B serology confuses you, you're not alone. This topic is commonly seen on EOR's PANCE, USMLE, and NCLEX, and it trips up students every year. I used to get it wrong like every single time during my didactic year, but now I can spot the right answer in seconds. By the end of this video, you'll be able to do the same. I'm going to show you a way that you will be able to spot the right answer with every hepatitis B serology question. So within the next 5 minutes, you will get this right. So the first thing when it comes to hepatitis B serology, the question may ask, what's the best initial test? Never in the questions let them confuse you what's initial test versus most accurate test. Always read that. So for hepatitis B serology, the best initial test is HBsAg, hepatitis B surface antigen, and the most accurate test is HBV DNA PCR. So moving on to the next segment, here's a question that you'll likely encounter during your exams, and see if you can answer this question. And if not, don't worry about it. We'll go through it and see how we can narrow this down step-by-step approach so you get it wrong. So I'll give you about a minute to read a question, and then we'll proceed with the strategy. One other tip that I can give you when it comes to the exams and saving time is always read the last sentence first. So in this case would be, which of the following best describes the stage of his infection? Look at the answers and then read the stem. Because before I would start reading from the beginning, and in long stems I would just get lost halfway through it and don't forget, and I'll just have to like select C. So we'll get to this question later, but let's start the process. So when it comes to hepatitis B serology, the step-by-step approach that I utilize now is the step one is screen for HBsAg. HBsAg is indication that this is acute infection. The little S in the HBsAg stands for sick. And then you may also encounter something as HBeAg, which is hepatitis B envelope antigen. And that little e is basically saying this is epidemic, this is active replication, this is highly spreadable. But most of the times you will not see that in questions. They will usually just say HBsAg. So step one, screen for HBsAg. If the HBsAg is positive, the patient has hepatitis B infection. If HBc is negative, there is no acute infection. So step one, screen for HBsAg. If it's positive, we have infection. If it's negative, it's not active infection. Step two. So if the HBsAg is positive, the next thing to look for is it associated with IgM positive or IgG positive. IgM, so anti-HBc IgM is hepatitis B core antigen. Little c stands for the core. So if you have HBsAg positive and IgM positive, that is acute hepatitis B. And if the IgM is negative, but the IgG is positive, you have chronic hepatitis B. And sometimes I used to confuse the two, and the way I remember to separate them is M stands for moment, in the moment, and G stands for gone, so chronic. So HBsAg positive, AGM positive, acute infection. AGM negative, AGG positive, chronic hepatitis B. Moving on. What if the HBsAg is negative? Well, the next thing we're going to look at is this patient in recovery or is he having an immunity? And the way we do that, we look at for anti-HBs and anti-HBc IgG. So S, remember, stands for sick, so this is anti-sick, and the anti-HBc IgG is present. Both of these are seen in the question as positive. We are dealing with a past infection with recovery. And if they only mention that anti-HBs is positive and everything else is negative, that is the immunity from the vaccination. So HBs is negative. Look at the next two steps, anti-HBs, anti-sick, and anti-IgG. If they're both positive, you're dealing with a past infection with recovery. And if the only anti-HBs is positive, this is immunity from vaccination. So as a next step, let's summarize all of this and let's look at this table here. So if you have all negative across the board, that is just susceptibility. If the only thing that is positive is anti-HBs, so anti-sick, that means they're vaccinated. Past infection, HBsAg will be negative. Anti-HBs is positive, so is the anti-HBc. Acute infection, HBsAg will be positive, negative for anti-HBs, and you'll see IgM, not IgG. So positive HBsAg and positive IgG, that's chronic infection. So now, let's go to our question. Which of the following best describes the stage of his infection? 45-year-old male presents with a fatigue and a dark urine for 5 days. He has a history of IV drug use for 2 years and no recent travel. Physical exam revealed jaundice. Labs show elevated AST and ALT. Hepatitis B serology shows HBsAg positive, anti-HBs is negative, IgM anti-HBc is positive, and HBeAg is positive. So first thing we look at, HBsAg is positive. Next, we look at the IgM or IgG. IgM is positive, and we also have the little e is positive. So this is epidemic. This is highly infected person. So we can see acute hepatitis with high effectivity as the right answer. Result and immunity would be out of the question immediately because the HBsAg is positive, and a chronic is not the case because the IgM is positive. And to summarize it here, acute hepatitis B with a high infectivity, that is the correct answer. This is a combination of HBsAg positive, IgM positive, and also HBeAg positive. Chronic hepatitis B, that is not a correct answer. In a chronic hepatitis B, we'll have the HBsAg positive and IgG positive. Result hepatitis B infection, that would show negative HBsAg, anti-HBs positive, remember anti-sick is positive, and also anti-HBc positive. And an immunity will only show the anti-HBs positive. So I hope this helps you. This is how I studied. This is what helped me with all my exam questions in EOR and PANCE. I never gotten this question wrong. And if you find this information helpful, do me a favor, share it with your classmates and help me grow this channel. Hit that subscribe button and the like button, and I'll see you guys in the next video.